everybody, and welcome to this week's virtual KINSTRETCH class. So today what I really wanted to focus on was hip internal rotation. So I wanted to be very specific about the aspect with which we're training within the hip. So internal rotation, what that looks like is that position. This is going to be external rotation. Even though it's going in, we're looking at the angle at which the hip is moving rather than our knee and foot. Internal rotation, while it's not widely talked about or utilized, there's very rarely in our day-to-day life where we're ever recruiting that motion or that position. But why internal rotation is so important is because as we look at the structure of the hip, right? So we have our leg bone here, we have our hip bone here. Come together, that creates our hip joint. So the stuff, the space in between our leg bone and our hip bone, that's our hip capsule. Essentially, it's the stuff out that kind of protects the joint. It's the joint stuff. And that dictates how much range of motion we have in flexion, extension, internal rotation, and external rotation. When we externally rotate, right, as we're trying to get into, right, the bottom of the squat or something like that, what that does in the joint space is it actually kind of pushes in to the joint, or kind of tensions in. As we internally rotate, what happens in the joint capsule is we actually tension that joint out, or that joint space out, and it creates more elasticity in the joint capsule. Why that's so important is the more external rotation we have, the more overall joint room we have to then move. And so by increasing internal rotation in the hip, we allow for more mobility in every other range that we utilize. So that's why hip internal rotation is kind of honestly the holy grail of hip mobility. If you look at people who are about to get a hip replacement, need a hip replacement, or have had a hip replacement, most, if not all of those patients have 0 to even negative degrees of internal rotation. What I mean by that is if they're laying on their back and I test how much internal rotation their hip joint has, most patients will see 0, meaning that's as far as they go, or their neutral is actually starting an external rotation and they can't even get to 0 degrees of internal rotation. So there is a correlation between lack of internal rotation and overall hip health. And so that's another reason why I really stress internal rotation with all of you guys. So today, how we're gonna start, I'm gonna use 2 yoga blocks. Mostly what they're gonna be for is a pillow and something to squeeze. So grab some pillows or a foam roll or something like that. And that's pretty much all you will need for today. So we're gonna start out with our CARs, our controlled articular rotation. So we'll start out with our right hip, and we're gonna do it from this quadruped position like most of us are used to. So we're gonna start out in this quadruped position, hands and knees right under the hips, hands right under the shoulders. You're gonna pull your heel to your butt. We're gonna go back first. Remember, tight core, nothing moving in the pelvis. We're gonna bring this knee back into extension. Remember, nothing through that lower back. We're gonna rotate outside of the knee up towards the ceiling. Try and maintain that knee height as much as you can as you pull up towards the elbow and down. We're gonna do 2 more that direction. Nice, slow, controlled. Follow my pace. You should feel all that tension on the side of your hip. That's your hip joint. Last one, nice, slow, controlled, going back. Rotate outside of the knee, pull up towards the elbow and down. We're gonna reverse that, going to the elbow first, swinging out, back, down, 2 more, up towards the elbow, swinging out, back, down, low back, staying nice and still, nothing moving through that pelvis. That glass of water should stay on our back that whole time. It shouldn't fall over because we're rotating through that pelvis. Go ahead and switch legs. Left leg now, pulling that heel towards your butt. Going back first, hitting that roadblock, rotating outside of the knee up towards that ceiling, maintaining that knee height, pulling up towards the elbow. Down, second time, going back, rotating up outside of the knee up towards the ceiling, maintaining that knee height, up towards the elbow, down, last one, going back, Nice, slow, controlled. Reverse, elbow first, swinging it out, back, and down. Second time, up towards the elbow, swinging out, back, down. The last one, and done. We're gonna warm the capsule up specifically, so we're gonna start off with just isolating external and internal rotation. This is gonna look really similar to what we just talked about at the beginning. So we're gonna be laying on our back. We're gonna go right leg first, left leg's gonna be extended. Right leg's gonna be up at 90 degrees. So hip and knee are both gonna be at 90 degrees. With your hands, I want you to go hands right on your pelvis so that your fingertips are finding or touching that front bony hip joint or hip point. Why that's important is because it's hard to see, but as I go into internal rotation, I can fake internal rotation by hinging my hip bone up towards my face. So rather than faking that range, we want to, with our hands, make sure our pelvis isn't moving and we're just rotating. We're going to go through internal and external rotation. We're going to try and max out our range and hold for a 3-second count, okay? We're going to do 5 of these. So right leg's up to 90 degrees. We're going to go external first. So we're going to max out that end range, hold 3, 2, 1, reverse, internal rotation. It's not going to be as much for most of you. 3, 2, 1. We're going to do 4 more. If you're just on that verge of cramping, totally normal. Reverse. 3, 2, 1. We should be on the point of feeling pretty uncomfortable as we go through this. Reverse. 3, 2, 1. We got 2 more. External rotation. 3, 2, 1. Internal rotation. 3, 2, 1. Last one. 3, 2, 1. Reverse. 3, 2, 1. Relax. We're going to do opposite leg going up to 90, 90. I'm going to give you guys a different angle. We're going to go external first, rotating 3, 2, 1. Internal rotation 3, 2, 1. Reverse 3, 2, 1. Reverse 3, 2, 1. Nothing should move. Knee, hip, nothing should move. 3, 2, 1. Reverse. 3, 2, 1. We got 2 more. 3, 2, 1. Reverse. 3, 2, 1. Last time. 3, 2, 1. Reverse. 3, 2, 1. All right. Now that we're warmed up and now that we kind of are starting to get the feeling of what internal rotation should feel like, what we're going to do is we're going to lay on our side. Doesn't matter which side first. I'm going to do my right leg on top first. With my pillow yoga block, I'm going to put it between my knees. That way it gives me something to squeeze. We're going to do essentially what we just did, but we're going to isolate internal rotation. So now we're not focusing on external rotation at all, and we're just focusing on internal rotation. So same rules apply with this. You're going to take that top hand, you're going to put it right on your pelvis. That way, if you start to bring that hip up towards your face, you're going to feel it underneath your hand. What you should feel is those muscles engaging as we work through that range. Totally and completely normal. We want that to happen. Again, if you cramp, try and fight through that cramping as much as you can. What that cramping is neurological confusion. So it's your brain telling your body that in this position you are going to get injured. That's only because your brain doesn't know how to control this position because it's never been asked to do this before. The more you fight through that cramping, the more it reinforces to your brain that this is a normal and safe position for you to be in, okay? We're gonna do 5 of these again. 3-second holds. We're gonna squeeze that yoga block between our knees, pull that ankle up towards our face or up towards that ceiling. Hold 3, 2, 1, relax. 4 more. Pull 3, 2, 1, relax. 3 more, squeeze that yoga block. 3, 2, 1, relax. 2 more, squeeze that yoga block. 3, 2, 1, reverse. Last one, squeeze that block, really fight for that range. Fight for more, 2, 1, relax. We're gonna reverse, switch directions, or switch hips. Squeeze that yoga block. Go on 3, 2, 1, relax. Second round, squeeze that yoga block. 3, 2, 1, relax. Fight for more range. 3 more. 3, 2, 1, relax. 2 more. 3, 2, 1, relax. Last one, fight for that range. 3, 2, 1, relax. All right. Hopefully we're warm at this point. Next thing we're gonna do is we're gonna go into our beloved 90-90 position. So with that position, if you're brand new to this and you haven't heard me or had the pleasure of getting tortured into this position, we're gonna make 90 degrees with our front leg, 90 degrees with our back leg. That back thigh should be parallel with that front shin. Front thigh should be parallel with that back shin. For the most part, what we've focused on is this front leg, but today what we're gonna focus on is this back leg. So first thing we wanna do is we wanna tension or stretch that hip capsule. So how we're gonna do that in this position is we're gonna take our upper body and we're gonna rotate towards our back leg. Now, a couple ways we're gonna do this, and I'm gonna explain to you how you're gonna feel this stretch. So we can tilt our pelvis forward or we can tilt our pelvis back. We wanna tilt our pelvis back or create posterior pelvic tilt. How we're gonna do that is, if the right leg is in back, you're gonna take your right butt cheek, you're gonna try and touch that right butt cheek towards the ground. From that position, you're gonna take your belly button, you can use your hands, rotate your upper body towards that back leg. Now, for some of you, if you have limited internal rotation, you might feel a pretty intense stretch without even rotating. Totally fine, wherever you are, wherever you find that stretch, that's where you live. For those of you who are a little bit more mobile and a little bit more flexible, if you're in this position and you still don't really feel anything through that hip capsule, you're gonna sit upright, take your right hand, grab your right ankle, left hand, grab your left thigh, pull yourself into even more rotation, trying to get your sternum towards your foot, okay? One of those positions you should feel through that hip. Now, what do I wanna feel? What I wanna feel is I wanna feel a stretch deep in this hip. The stretch should be almost uncomfortable, but not painful, okay? So that stretch should be almost like you can't quite put your finger on it. It should feel deep in that hip. That's what we want. We want it to feel like I'm almost coming in, taking your femur or your leg bone and just wringing it out like a towel. That's what it should feel like. It's a weird, almost uncomfortable sensation. Bear with me, okay? The only place you should not feel this is on the inside of your knee. If you do feel that on the inside of the knee, you're gonna grab something, a pillow, that yoga block, you're gonna put it underneath your knee. That should relieve that tension on that knee. If you still feel it, what you're gonna do is you're gonna close the ankle. So you're either gonna pull your knee into towards that front leg, or you're gonna bring that heel towards your butt. If that still doesn't take care of it, bring this front leg in, okay? So be wherever you need to be to feel that stretch through that hip, okay? Now, once you've identified that stretch, again, it shouldn't be so intense that you feel your body fighting you back, right? If you feel the leg tensing up, you've gone too far. So back off that stretch, either back off in rotation or come out of that pelvic tilt a little bit, okay? So from here, first thing we're gonna do is we're gonna do a PALS contraction. PALS stands for progressive angular isometric loading. Essentially, we're gonna ramp down, not moving the joint. So, like we've done previously, we're gonna imagine that there's a weight scale right underneath our ankle, okay? We're gonna try and push our ankle into that weight scale. Now, you're gonna feel some things kick on in the hip. Totally normal, okay? So this first set, we're gonna start nice and light. Second set, we're gonna ramp up. Okay, so that weight scale's underneath that ankle. This knee and ankle should stay on the ground. If they're not on the ground, if that knee is up a little bit, put something underneath that knee so that front knee has something to push into, okay? We're gonna start at 5% effort, nice and light, pushing that ankle in towards the ground. You should feel that glute kick on. We're gonna go 10% effort. 15%, 20%, hold there, 5, 4, 3, 2, 1, slowly relax. Now, this time we're gonna ramp that intensity up. So we're gonna go up into the 50-60% effort. If you feel like you hit, say at 40%, you're like, I feel like if I go any further, something weird might happen. Stay at 40%. Again, this is your friendly reminder, we don't want any pain, okay? So if at any point you feel pain, either back off the intensity or back off the stretch. Okay, we're gonna start at 10%, driving that ankle into the ground. 20%, 30%, 40%. Every step or every level should feel different. 50%, things might start shaking, totally normal. 60%, hold there. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Slowly relax that contraction. Good. Now we're going to reverse that. So now we're going to actually lift this foot up off the ground. Now here's the kicker. If you're in this position and you try and lift that foot up off the ground and you're like, Caitlin, that's not going anywhere, here's what we're going to do. The easier it is to lift that leg off the ground is if you are rotated away from that leg and leaning forward. So the further away from that foot you are, the easier it is to lift off the ground. The more upright you are or rotated you are, the harder it is to lift off the ground. So you're gonna find whatever position you need to be in to lift that foot up off the ground about a ½ inch. So if you could slide a nice paperback underneath that leg or that ankle, that's what we want. Now, the kicker, we wanna make sure we don't dip out of that position at the last second to lift that foot up off the ground. So there's a difference between that, if you're watching my hip, and that. You see what I did at the very end? I rotated that pelvis in order to lift that leg up off the ground. So wherever you need to be, isolate yourself in cement so that that hip doesn't move. If you want to take that hand and again put it right there so that if you feel yourself rotate forward to lift up, totally fine. We're going to do 2 of these. First one holding 5 seconds, second one holding 10 seconds. You're likely going to cramp. Bear with me as best as possible, okay? So find that position where you need to be, where you can lift that foot up off the ground. Okay, we're gonna go front knee, front leg or foot, driving into the ground, lift, 5, 4, 3, 2, 1, relax, reset, catch your breath. If you need to shake out because you're cramping, shake out because you're cramping. We're gonna go this one, we're gonna go more intense. We're gonna go 10-second hold, okay? Fight with me, this is how we build better hips. Drive front knee, front foot into the ground. Pull, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and slowly relax. Good. Shake that out, catch your breath. We're gonna do the same thing, but on that opposite leg. So remember, front shin is gonna be parallel with back thigh. Back thigh is gonna be parallel with front shin. We're gonna find that stretch. We're gonna tilt that pelvis back. We're gonna rotate our upper body. For me, this leg has a little bit more internal rotation than the right leg. So for me, what I'm gonna do is I'm actually gonna be in this position as we go through this. So again, you should feel that stretch deep in that pelvis, almost like you're wringing it out like a towel. Only place we shouldn't feel it is in that knee. So if you do feel it in the knee, elevate that knee. If that doesn't take care of it, close those angles down. If that still doesn't take care of it, bring this knee in, or foot in. Okay, so from this position, we're gonna start with our pales contraction. So we're gonna be driving ankle into the ground. So weight scales underneath that ankle. We're going 5% effort pushing down, 10%, 15, 20, hold, 5, 4, 3, 2, 1, relax. Round 2, this is gonna be more intense, starting at 10%, 20%, 30, 40, 50, 60, hold, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and slowly relax that contraction. Good. We're gonna do our lift-offs now. So we're gonna rotate out of that position. We're gonna find whatever position we need to be in to lift that foot up off the ground, nothing moving through that pelvis. We're gonna do 2 of these. First one's gonna be a 5-second hold, second one's gonna be a 10-second hold. Driving both knees into the ground, front ankle into the ground, lift leg, 5, 4, 3, 2, 1, relax. Round 2, catch your breath, 10-second hold. Driving knees into the ground, lift, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Slowly relax, catch your breath. All right, we are gonna finish with a little bit of a challenge. So I only have 2 yoga blocks. If you have more things to stack, you can kind of play around with this on your own. But what we're gonna do is we're gonna go face down. And now from this position, we wanna finish into this position where our leg is in 90 degrees. So making a 90-degree angle where that front hip is trying to drive down towards the ground. From this position, what we're gonna do is we're gonna see how far we can internally rotate to lift off, okay? But we have to get there actively. So rather than just having you meet me here, we're gonna work to get there. So you're gonna pull your heel to your butt, you're gonna lift your leg up off the ground, you're gonna rotate outside of the knee up towards the ceiling, trying not to rotate out of our pelvis, continuing to pull knee up towards armpit until you feel like you can't go any further, and gently set down. Now, if you wanna start, you can start putting that first yoga block underneath your ankle. Again, trying to drive this front hip down towards the ground. We're gonna do 3 of these, lifting off for 5 seconds. This is how we're gonna finish the class. So, if you don't have an object or anything like that, you can just lift off from the ground. But we're gonna drive that left knee into the ground and lift, holding for 5, 4, 3, 2, 1. Relax. If you wanna stack something even higher, you can. 2 more, drive knee into the ground and lift. 5, 4, 3, 2, 1. Relax. Again, you can try and challenge yourself even more. Last one, make this one your best one yet. Drive knee into the ground and lift. 5, 4, 3, 2, 1. Relax. Now we got to get back to where we were. So we're going to lift that knee up off the ground and start rotating back until we're back to where we started. We're going to do the same thing on the other side. Starting in that 90 position, so pulling that heel towards your butt, lifting knee off the ground, rotating outside of the knee up towards the pelvis, not rotating out at all, pulling knee up towards your armpit until you can't go any further, gently set down. We're doing 3 of these, driving that front hip bone down towards the ground, driving knee into the ground, and lifting. 5, 4, 3, 2, 1. Relax. If you want to put something underneath your foot, you can. Drive knee into the ground, hip into the ground, lift. 5, 4, 3, 2, 1. Relax. Last one, challenge yourself. Make this the best one yet. Knee into the ground, lift. 5, 4, 3, 2, 1. Relax. We got to go back the way we came. So we're going to pull knee up, swing it around, and finished there. So that was your internal rotation class for the week. Thank you guys all so much for following along. Please be sure to check back in next Tuesday for your next virtual KINSTRETCH. Happy quarantining.